Another round of symptoms. So let's say you're constantly bloated. Pretend this is your belly for me. Oh, ooh.
Uh-oh, you also got a
It's
little
leaking. Yeah.
anal leakage.
You know, and let's just say you're constantly bloated and, maybe you do have a little bit of leaking down there, but overall, things aren't really making sense because but you're bloated. That doesn't feel like a very pleasant experience in the belly, right?
No.
Then you're constipated. You feel like you got to go, but you can't go. And then, whoa, then you have diarrhea. What could be going on, right? Maybe irritable bowel syndrome. We've heard of that. But believe it or not, you may want to have a blood test if you have repetitive symptoms like that because it could be something else.
Something else. You never want to just assume it's IBS. You got to rule out other things. And there's a blood test that can reveal if you might have celiac disease. And what celiac disease is, it's actually pretty common. 1 to 2 million Americans actually suffer from celiac disease. And basically, you don't have the ability to digest certain things that are in some of their grains, like wheat, rye, and barley. And basically, it gives you all the same symptoms as IBS, but it's treated differently.
But celiac disease is interesting because without that blood test, you'll have these constellation of symptoms, but you're not going to necessarily be able to make the diagnosis. And here's why. Celiac is actually a response by your immune system to the gluten in certain foods. And those villi that you're seeing there are in your intestine. They line your intestine and help you absorb nutrients. But if you eat gluten and you're allergic to it, your body will release antibodies, and then it will cause all those symptoms we talked about, but also potentially cause poor nutrient absorption, etc.
Yeah.
So you'll get the
malnourished.
bloating, you'll get the diarrhea, you'll get the gas, abdominal discomfort, all these symptoms. But unless you get it tested, you're going to probably get misdiagnosed.
Exactly. IBS and celiac, they can be similar with the bloating, gas, and diarrhea. But celiac has difference in maybe tingling in your extremities, rashes. Pain is not relieved after you have a bowel movement. Usually with IBS, after you sit on the toilet, you feel a little better for a while. With celiac, it's different, usually don't.